Patient with grade 3 renal failure was on medication for diabetes from 2005. Currently on medication for hypertension and cholesterol too. The doctor had advised insulin injections instead of medication as the kidney were damaged. Suffering from arthritis for the last 22 years due to pain in the knees, back and hip, it was difficult to get up and move without assistance. Even though glaucoma surgery and cataract surgery were done, reading was not possible. At present, knee replacement has been advised. In addition, memory loss is growing and treatment has been going on for ulcerative colitis and varicose veins. Thyroid operation has done 43 years back and has necessitated thyroid medication for the last 43 years. Let us see how clinically supported lifestyle correction helps a patient having so many multiple health issues to taper off and stop medications, avoid the need for surgery, how lab investigations help to monitor health improvement in the patient so that medications can be reduced and tapered off, the nature of improvements seen in the lab investigation results, the time taken for blood glucose level and HbA1c to reach normal levels without any medication, the time taken for the patient to regain independent movement without the need for support from others, what were the improvement in the health of the kidneys, how much did the GFR increase, whether the frothy urine and albuminuria had stopped, whether there was any improvement in the health of the eyes and vision, and whether the loss of sensation and the burning sensation in the limbs stopped, etc. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and taper off medications. This can help you understand how valuable are the lifestyle correction needed for overcoming any chronic lifestyle disease. Most importantly, what advantage is such an approach as when deciding on undergoing surgical procedures or continuing with lifelong medication. To know more about different lifestyle diseases, treatment options, reversal of lifestyle diseases with lifestyle modulation, etc., you may search our healthcare channel. When we come to the details of this patient, it's a lady, she's 73 years, height 146 centimeters, weight 62.2 kg. When we come to the medical history, she's diabetes from 2005 and also on medication for hypertension and dyslipidemia. And her nephropathy was diagnosed in 2014. And the eye problem is there, that is glaucoma and cataract surgery is already done, and also retinopathy is there. For the last eye problem diagnosed for the last 13 years. And neuropathy, limb extremities, that hand and foot burning sensation is there, and also numbness and reduced sensation. She's wearing special footwear also because it may fall off if they're using slippers. And memory problem is there. Memory is reducing. It can be in dementia or it can be Alzheimer's disease. So whatever, the memory is reducing. And she's on this statin medication also. The statin is actually can give this memory reduction, which is very common with those who are using statin also. Next is thyroid. She has history of giving thyroid surgery since 1997. And from that day onwards, she is on thyroxine. And another major problem for her is the joint pain. Joint pain and difficulty in walking, and the support is needed for getting up and even walking also. And arthritis of the knee, pain is mainly on the knee, hip and the spine. Next is gastric problems for her. She was diagnosed with the ulcerative colitis in 2012, cecum and ileal colitis. It is endoscopically diagnosed actually. And she's taking medication for that from the Ayurveda. She's tried initially with the modern medicine, but she's not finding it comfortable, so she shifted on to Ayurveda and she's maintained on that actually. Next, when we come to the surgical history, she had undergone thyroid surgery, and in 1997, six seven, 1/6/7, that is a small part of the thyroid is kept intact. Actually, according to the patient, maybe, and according to the patient, is 1/7 of the is left behind, and sixth part is removed, one part is kept, and most probably it is to keep that one small part is kept. That is usually in this multinodular goiter surgeries. Small part of the one, at least one parathyroid. There are 4 parathyroid glands. One parathyroid gland, at least, the doctors will try to preserve. Otherwise, the parathyroid gland and the thyroid gland, not only the thyroid hormone, it is making this parathyroid hormone and also the calcitonin. These two hormones are actually controlling the calcium metabolism. Calcium is not needed for the bone strength, and also that is actually the calcium is very important for the heart and muscle function also. Actually, calcium channels, it is activity of the calcium channels, this muscular activity is taking place normally. So that is very important. That may be the reason one of the small part of the thyroid gland is left behind. And she had undergone cataract surgery, eye surgeries also multiple times. One is for the cataract removal, that is 3 years ago, and also she has undergone glaucoma surgery. Even with that, she's not able to read. Even with using the glass, she's not able to read properly. Next, she's another problem with her is varicose veins. For that also, she's taken Ayurvedic treatment. That is, in the Ayurvedic treatment, they use this leech therapy also is one of the aspect. And she's maintaining with the Ayurveda in that. She has not gone for any surgeries for varicose vein with the modern medicine. Then the family history, when we take care, so father is diabetes and mother is arthritis. Mother had arthritis also. So when the clinically supported lifestyle correction, before we go for the starting treatment, we do a detailed analysis of the blood parameters will be analyzed, and detailed testing will be done. And when we come to the day 1 or before starting, what was her symptoms and what was the medication and test reports, etc. The symptom wise, her main problem was joint pain and not able to, free movement is not possible. She need to get up, some support is needed because her hip, back and the knee is weak and painful also. And walking also, and she's not able to climb the stairs. And next is numbness and the burning sensation of the extremities, especially hand and the feet. That is because, most probably because of the neuropathy. And gastric discomfort. She's already diagnosed with colitis and ulcerative colitis. So that's an autoimmune disease that may be one of the reasons for the gastric discomforts. And vision problem. She's having multiple vision problems. That is, one is glaucoma is there, cataract is there, and diabetic this retinopathy will be there, and also another reason for this hypertensive retinopathy may be also a part of, because multiple diseases are affecting the eye vision also. Then memory is getting reduced. That is, this diabetes and hypertension both can create small impacts in the brain. This is silent infarcts can be produced, and also because of the blood circulation problem, the damage to the blood vessels, the brain cells getting damaged. That is the sign. Next is this deformity. Actually, her knee is deformed. I guess deformity is there, and also the toes also is going to one side. There is clear deformities are happening in the toes also. Next, what are the medications she's taking? This after the surgery, she's taking 100 micrograms of the thyroxine and rosuvastatin for the cholesterol, and telmisartan and benedipine for the hypertension, and metformin, vidagliptin, glimepiride 2 milligram morning and 0.5 milligram evening, and metformin and vidagliptin twice a day she's taking, and methylcobalamin, that is for the neuropathy pain, lipoic acid, and evion LC, that is carnitine also she's taking. That is all given as a supporting measure for the neuropathy. Next is when we come to the blood test. Even though she is on medication for the diabetes, diabetes is not under control. HbA1c is 8.8. Now, because of her kidney function is reduced, she is advised to take insulin also. But her insulin level is normal. It's only type 2 diabetes. Glucose level also high, 190, and the insulin and C-peptide is normal. That means it's only type 2 diabetes, and her pancreas function is normal. So if the pancreas function is normal, if you are able to control your diet, you can get out of the diabetes. That every type 2 diabetes patient should understand that it is a reversible condition, 100% reversible condition, because your pancreas is functioning properly. So most of the patients believe that those who are taking insulin and all the diabetic medicines, so even if it is type 2, they think that it is their pancreas is not functioning properly. No, it is your pancreas is functioning properly only because of the excess fat and the insulin resistance. You are forced to take more insulin. And in the treatment, it is actually unscientific. Taking when the hormone is already normal, giving insulin injection or taking medicines which is increasing the insulin production. I have seen patients, type 2 diabetes patients with even 250 and all insulin level. So it's very dangerous, because the high insulin also is dangerous actually. Just like low insulin, any hormone which is in high level also is abnormal. Diabetic patients, we always look, especially those on medication, type 2 diabetes, we should look into the amylase and lipase to see any chronic pancreatitis that's there. With this patient, there is no chronic pancreatitis, amylase and lipase is normal. If the chronic pancreatitis is there, amylase and lipase is high, then we should look for a tumor marker for the pancreas cancer. So diabetic patient with the chronic pancreatitis can go for a pancreatic cancer. So it can be diagnosed in very, very early, 10 or 20 years before the pancreatic cancer manifested. So we can, there is special tumor markers. I think this tumor marker CA 19.9. It is specific. It is specific for the pancreas, and that has to be looked into. But her case, it is normal, so we don't go for that. And she's on the statin, and her cholesterol is okay, but her high glyceride is high. That we should, all these dyslipidemic patients should understand that it is very easy to control cholesterol with the statin, because it is blocking the production. Cholesterol is a thing which is produced by the body. It will block the production. But triglyceride is more harmful actually. It's more excess fat is circulating in the blood. That is actually getting deposited in the blood vessels and creating blocks. So here case also the triglyceride is high, and still the good cholesterol also is low. The lipoprotein A, that is another form of lipid parameters, and it is also very high. The most important thing is her GFR, that is her worrying them. GFR gone down 41, that is grade 3 renal failure. Creatinine is high, 1.3, and blood urea is high, and microalbumin, the urine microalbumin is high, and liver function also there is abnormalities. Bilirubin and albuminuria is there. WBC count, that is general inflammatory marker, is also high. She is on thyroid medication, and the thyroid function, the T3, T4, TSH is normal. And anti-TG, that is one, because if she had a surgery, so it is always good to look into the thyroid antibody parameters also to see whether there is any underlying autoimmune Hashimoto thyroiditis also, or even the other type of thyroiditis. Then next is her body parameters. The body parameters weight is 62 kg, 62.4 kg. Her she is very short, only 146 centimeters. 146 centimeters and 62.4 means she is obese, and the BMI is high, 29.3 is there. And BP also, even with medication, BP is slightly high. That's okay, 130, 126/86. Abdominal circumference, that is abdominal obesity is there. Abdominal circumference is 104 centimeters. And her body age is above 80. Usually, most of the missions which is looking for the body age and body composition, etc., will give the body age up to 80 only. If it is more than 80, we will not be able to find out. And her body age is more than 80. And fat percentage is very high, 48.4. The body, usually the women, it is always better to have fat percentage around 25%, but it is almost double, 48.4. And that is the reason for these autoimmune diseases and this arthritis and all, is because of this excess fat. Excess fat is inflammatory. The fat is inflammatory, and the changes which is inflammatory markers are coming out from the fat actually. Next is when we come to the final the diagnosis after the investigation, from the symptoms and the history and the symptoms and the blood test, we come to a conclusion of the diagnosis. And what are the diseases she is suffering from? Diabetes is there, hypertension is there, dyslipidemia, that is cholesterol and triglyceride is high, and she is basically advised for injection also too, because he is having nephropathy. Nephropathy is there, retinopathy and neuropathy. All the diabetic complications are actually all the systems are affected with the diabetes and hypertension. And this dyslipidemia, that is all metabolic disorders actually. It has affected her kidney, eye, and also the nerves. And the eye also, different parts of the eye. This glaucoma is there, and also cataract is there, and retinopathy. Next is hypothyroidism. Hypothyroidism is because of two reasons. One is surgical removal of the thyroid gland, and also that is partial thyroidectomy has done, and also Hashimoto thyroiditis is there. Next is arthritis. Arthritis of the knee and the spine and hip. Different systems is affected. Different joints are affected, and she was advised to have a knee replacement surgery. But knee replacement will only give some benefit for the knee only. But at this age, 73 years, undergoing such a major surgery and rehabilitation of that, and will be very difficult and very painful also. And it cannot guarantee any result, especially when your hip and the back also is affected. And gastric problems. She is already on medication for the ulcerative colitis and varicose vein. With the Ayurveda, not with modern medicine, with the Ayurveda treatment she is undergoing. And memory problems. Memory is deteriorating. Next, when we come to the category, which category of the disease it is? It is metabolic. Major one is metabolic syndrome. That is actually the starting is with the obesity, diabetes, hypertension, dyslipidemia. So metabolic syndrome is there, and also autoimmune. This autoimmune nature is Hashimoto thyroiditis and the ulcerative colitis and the arthritis. All these three are of the, and the varicose vein. All the four is for the category of the autoimmune disease. Next, when we come to the clinically supported lifestyle correction. In the clinically supported lifestyle correction, what we are trying to do is to give optimal nutrition, optimal exercise, and minimize toxins entering the body, because the patient is having kidney failure. So when the kidney has to excrete all this waste material, so the patient, the toxins entering in the body has to be also reduced. The major toxin we are consciously taking is the medication. Any medicines, it is for the body, it is a toxin. And hypertensive and diabetic medicines are toxins. That is why the doctor has asked her to change over to insulin, because to reduce. But the insulin also will reduce the strain of the kidney and increase the hypertension pressure, because insulin in its nature is it will produce sodium retention. So we'll reduce the sodium. I'm asked to reduce the sodium in patients with kidney hypertension. But if you are taking insulin or the insulin level is high, that itself will create a problem. So anything which is more than normal, even the insulin, it's a hormone, it is more needed for the body, but if it is high level, it is also harmful for the body. So in diabetes, what we do is we'll do the if it is a type 2 diabetes, the diabetic medicines will be stopped in the initial first day itself, and the other medicines, the diabetes, hypertension, and the cholesterol medicine and all, we gradually watch the BP, record the BP at home, and when it is reducing, taper off the dose, and also the cholesterol also for the taper off the dose. That is the pattern of doing. And next is what are the changes which happened with the clinically supported lifestyle correction. Basically, when we will always think that what is the difference between the self lifestyle correction and the clinically supported lifestyle correction. See, in the self lifestyle correction, we are with our own, each person's understanding and each person's circumstance, they try to correct it. In clinically supported lifestyle correction, they are more clear-cut direction and support is given. That is why, because the optimal nutrition is there, optimal exercise is there, what they are eating, what is the patient, what the patient's food and the activities, we are getting a very clear idea about it. So that is the reason why these patients get a very good result also. So when we come to the changes with the clinically supported lifestyle correction, first the symptom, that is the pain and the symptomatic relief, that is the most important for the patient. When we look into the symptoms, her major problem is joint pain. She is not able to get up or walk without support, and with the support also it is painful to move. So her pain and discomforts were reduced to almost 40% to 50% by the 8th day itself. We follow the patient on the 8th day, 15th day, and then every month in the clinic or the clinical background, and daily follow-up at the from online follow-up, especially till the medicines are over. For this PP and medication is over, we follow up on a daily basis by online. Not to patient, not to have to the hospital or for the daily follow-up. That will be done on as an online procedure. And the other every 8th day in the initial 3 weeks, 2 weeks, 8th day, weekly, and then monthly follow-up. And by the 15th day, her pain was almost 60% relieved. By 30 days, she was able to walk and even climb her stairs without any discomfort. Only mild pain was there, only 80%. She's saying that 80% pain is gone. And by day 60, 90%, she's almost fully okay. And by 90%, she's able to do all the activities without any pain. And need for support is gone by the 15th day itself. She's able to come walk and climb and stairs and all, okay, without support, maybe with a mild pain that time. Then burning sensation and numbness, the neurological problem, neuropathy symptoms is reduced to 50% by the day 15 and by 80% by day 15, and by 30 days there's no problem at all. She's able to wear the normal chappals also. It is not going off. And gastric discomfort, 70% problem is over. And by the 8th day, and by day 15, she's able to come out of gastric problem totally, and she actually reduce her this Ayurveda medications also. Then what about the vision? Once vision is gone, it is very difficult to get it back. Actually, she was not able to read with the glass also even after the cataract surgery and the glaucoma surgery. But she has noticed a clear evidence of improved vision by the day 30. And it is just gradually increasing, and she's able to read. Now she's vision is improved and she's able to read properly. So that is one of the without able to read, it is very difficult in a modern world to live. Next is memory. Memory also, she noticed by the 30th day, memory also increased. And the medication also, that also is reducing. That we'll come to the medications later. And this gradually the memory was increasing. And the knee and toe deformity, that is valgus deformity for the knee and the great toe was there. And that also is reducing, and it is evidently reduced by the day 90, because small changes will not be able to make out in the early days. The pain and symptoms we can make out in the early, but this deformity and all, it will take time, and also to correct also it will take time. Next is medicines. Actually, by the day 1 itself, we stopped all the diabetic medicine and the food supplements, which is taken for the nutrition supplements, is taken for neuropathy, and all is stopped on the day 1 itself. And on the day 8, when she came, all thyroxine was continuing, because we didn't reduce the thyroxine on the first day. Only from the 8th day, the second week only, we started reducing the thyroid. The rosuvastatin also initial day itself, it is reduced to half the dose. And telmisartan, that is only 2 tablets she was taking initially, only half telmisartan we are taking on the 8th day. By 15th day, all the medicines were over. This hypertension medicine also is over. And this thyroxine started reducing. Thyroxine is reduced to from 100 milligram to 25 milligram by day 90. Even her partial thyroidectomy was done actually. Thyroidectomy is only a small part of the thyroid is kept back. But that thyroid is able to maintain her thyroxine actually. By 25 milligram, with that the thyroid function was my thyroid was normal. And that also gradually we were able to reduce that also by 180 days. So without any thyroid hormone also she is able to maintain normal thyroid function. Next, when we come to the blood reports, HbA1c, which was actually 8.8 with medicine, it was come down to 8.68 the day, then to 8.1, then to 7.1, then to 6.1, then to 5.7 by day 90. And she is able to maintain it by the day 180, it has come down to 5.3, non-diabetic stage. And even in 120 also she came. Actually 120, it was come down to 5.4 or something. I didn't note it down because the chart will go, the size will be increased. So by day 90 itself, it is everything is the sugar actually, blood sugar was corrected by the 8th day. She was actually 24. We are following it up at the home also. By the 8th day itself, 24 hours itself, her blood sugar was normal. She's a person who's very well systematically looking at, not very punctual patient actually. And her blood glucose was throughout normal after that. And cholesterol was throughout normal, but initially with the medicine. But after day 15, there is no medicine. Without medicine, the cholesterol is maintained. And the triglyceride also, with medicine also, her triglyceride was abnormal, 290 was there. But it came down to 147, right? Gradually it reduced. And also her HDL was low initially, and it gradually increased, and it usually HDL takes some time because the metabolism has to get corrected. So HDL was corrected, but 180 HDL also came up to normal. And lipoprotein A also, it was very high, and by 180 it was also increased. It reduced, it was high, it is reduced to normal. Then the kidney problem, that is one of the major problems. Grade 3 renal failure, 41 only. The initial, and it increased by the next week itself is 45, then 47, then 1 month it is 50, GFR increased, and then by 90 days 56, and then by the 180 days it is increased to 73. See, it's grade 1, grade 3 renal failure to grade 1, and if she is maintaining it, everything is perfectly, she is following it up, she may have a chance to increase the GFR to 90 above. So even if maintaining this 73 is also sufficient actually for her in her lifetime. If she's maintaining this, she need not go for a renal failure or dialysis or a renal transplant or anything if she's able to maintain this. Accordingly, the creatinine was 1.3 initially, it came down to 0.8. And urea also came down. It was 34 initially and then 17. And microalbumin, that is another renal function test, is microalbumin was high, and in the it was not only slightly high, 41. It came down to 15, and the 8th day itself. And liver function also was abnormal, because this metabolic liver is the center of the metabolism, so it will naturally, all this will affect the liver also. And the liver albumin and the bilirubin was high. It just came down to normal within 15 days. Actually, 8th day we didn't look into, usually we don't look into, and if it is not that high. So in the 15th day itself, it just came down to normal. And the WBC count, that's a marker of the inflammation, that also came down to normal by the 15th day. Next is the thyroid problem. Thyroid is on supplements. Thyroxine was 100 milligram, but we started reducing it, and even with the reduced, even after stopping, the thyroid hormone level was maintaining, and the TSH also persistently, continuously, even without medicine, it was normal. That the only part of this, she had undergone a thyroidectomy operation, a partial thyroidectomy. Only part of the thyroid is there, but with the proper nutrition and exercise and this part of the small part of the thyroid which is able to maintain her functions actually. And anti-TG, she's having, not only the thyroid was partially removed, her thyroid, Hashimoto's thyroiditis, autoimmune disease also is there. The autoimmune marker, the anti-TG has reduced from 36.2 to 25.2 by the 180 days. Next, what are the changes happened with the body parameters? See, in the clinical, this lifestyle correction means we had to correct the body parameters at the macro level, that is the muscle and bone or the weight, that is the macro level, and also at the micro level, that is cellular level. What we are trying to correct is the lean mass fat mass ratio, that is ideally it should be around 1.5 or 1.4. And then omega 3 and 6, actually these lifestyle diseases are all inflammatory, and for the anti-inflammatory and inflammatory activities should be balanced, so that is controlled by omega 3 and 6. So what we are trying to correct is not only the lean mass fat mass ratio, to correct the omega 3 6 balance to 1:1. That is the reason for this fast recovery actually. So you're supporting the recovery or the repair activities of the body by increasing this, giving enough omega 3 fat and removing excess omega 6 fat which is deposited in the body, which is inflammatory. See, her weight was 62.4 initially, and it was reduced within a week itself. Within a month, it came down to 57, almost 5.5 kg reduction. Then 50.5, that is almost 12 kg reduction in 3 months. And she again further reduction by 180 days, she is able to come down to 44.8. It's a very good result actually. And BMI 29.3 initially, and it came down to 21. And the BP, with the medicine, it was slightly high, but without medicine from the second week itself, it is completely managing without any medicine. We're keeping it normal. Abdominal circumference was initially 104. It came down to 81. You can imagine the change what is happening in the body, that the shape also is getting corrected. That is very important. See, the beauty, shape and health and everything is going actually in a parallelly actually. The body age, actually it was more than 80 initially, on the 30th day also more than 80, but by the day 60 it came down to 78. Now only we can follow it, what is the changes. By day 90 it came down to 75, and day 180 it came down to 68. So her real age is 73, and when we started we don't know, it was only, we know about it is only 80, above 80, maybe 90 or 94 or something like that. and because we don't have measures to measure that. But anyway, by 180, she is able to come down to 68. Anyway, 5 years less than the actual calendar age. And that patient also feel the change. She was not able to even walk, get up properly without support. But now she is free from all the medication and all the symptoms, pain and discomfort, and everything is gone. Even she was not able to read. She is able to read also. The change will it's not only in the digitally or the calculation or thing. It is the patient is able to feel the changes, and that is the most important thing. Then the fat percentage also reduced 48.4 to 42.2. It's a need further more correction if we are able to, if the patient is able to stick on more further correction and further reduction and improvement of the health is also possible. Next, we'll see what are the before and after. What are the changes happen? That is always in a lifestyle correction and all. What are the changes before, how was weight reduction and all, before and after, we'll always think of. So when we consider about the before and after, when we come to consider the symptoms, the patient is having so many symptoms, pain, difficulty in walking, needs support for many of the things, and the pain and numbness, burning sensation, gastric discomfort, vision was compromised and not able to read, memory was reduced, and knee the deformities was there. Actually, all the symptoms was gone. Actually, it is not by 180 days. Almost in the first month itself, she's symptom free actually, and slight pain while walking or something like that. That was the only symptom, and also even the vision started increasing by the 30th day, and memory also. She felt the memory also is increasing. So all the symptomatic symptoms was gone, and the memory and other things is improved, and even the deformity on the toes and the knee has also reduced. That because of this degenerative, this cartilage and the degeneration in the knee, there will be deformity will be there. But it is very common. We are seeing the patients with osteoarthritis and advised knee surgery, but they are able to overcome the pain very fast within 2 weeks or 3 weeks, and even the deformity will be also reduced. That is because the new cells are forming and the cartilage is reformed. That is actual repair of the cartilage is possible with the food and exercise alone. No need for injection of so many other medical parameters or medical research are going into for this cartilage regrowth and all. Just by simple diet and exercise, it is we can regrow, because the body is made of food or nutrition. If you are able to give it correctly, you can correct it actually. You can repair it. Next is medication. She was taking so many medicines, almost 10 tablets she was taking, and within a month itself, I think by the 15th day itself, except that thyroxine, she was able to stop. But by the 180 days, the thyroxine also stopped. No medicine after that. And blood reports, she was so many blood parameters was abnormal, and everything is normal except this slight GFR. GFR was that is kidney function is improved a lot. Only thing GFR improved only up to 73. If it is above 90, then that also is corrected. And for the thyroid, that anti-TG was slightly 36, but it is improved, reduced to 25. It is improved, but only two blood parameters which is not corrected. That is only GFR, but it is both are improved with marked improvement is there. Grade 3 renal failure has come down to grade 1 also. Next, when we come to the body parameters, there is marked change. The body shape has also changed. The weight from 62.4 to 44.8. So almost 18 kg reduction you can think of, and the abdominal circumference is reduced from 104 to 81. So drastic change is there, and we are always better to keep the low normal of for the Indians. For we are Indian people, so she's basically her BMI upper BMI should be between 18 and 23. For the Westerners, especially Caucasians, it can be 18.5 to 25. But for Indians, if the BMI is going more than 23, definitely the abdominal fat will be increased. So we always advise to keep, for this patient also, keeping the BMI around 19 will be the ideal at this age. Because less weight, you don't have to carry with all these joint problems that why should carry too much of fat. And BP is normal. Body age was came down. It was more than 80 and came down to 68. So with her calendar age is 73. She came down from that to 5 years younger than what her age, and she can actually come down around 60 to 65 if she try further. And fat percentage also reduced. Then when we come to the what will happen to her if she's continuing with the conventional treatment, that is with the changing over to insulin and other medications. And if you are starting with the insulin, definitely her BP control will be lost and she will be needing more medication for the BP also. But with that also, it will be very difficult to control BP. And the blood sugar also, hypoglycemia, chance of hypoglycemia is high. And so she will be needing more medication for the BP. And also she definitely, when we start with insulin, her weight will be further increasing. And if she want to walk, or she may go for the surgery, but with the surgery also she may not be able to, surgery for the knee replacement surgery, only knee can be replaced. But then if you, because of for the pain of the hip replacement also may be needed. So many operations. So if it is, if she's getting a definitely there will be blocks will be there. If she get a cut pain, she may need a angiogram. If she go for an angiogram with this renal function, it will further deteriorate with the contrast nephropathy. Definitely it will completely, she may go into grade 5 renal failure. So if there is any interference with when a patient is on renal failure, if any interference, medical intervention, then the renal function will go down. The medical intervention means there will be more medicine. More medicine, it will increase the stress of the kidney. Or investigation like a CT scan, MRA, or angioplasty, angiogram, etc. Again, there is the contrast, and that will reduce the function. So the chance of going for, with the medication, the chance of going for renal failure, progression of the renal failure will be much faster. And there will be immune surgeries, other surgeries may be needed, and diabetes, if an ulcer comes, again problem, and immunity will be compromised. With insulin, definitely immunity will be compromised, and the patient will be always, when you are a patient, will be always complex patient if you are on medication, because when you come to the accident with an accident or a infection, then you will be a complex patient because you are on medication for all these things. But now she is free from all the diseases. She is not on any medicine. Only her problem, because of her age, there may be some age associated problems will be there. Otherwise, she is a healthy person now. That is the importance, and the importance of sticking with the lifestyle, this medication, and going for the lifestyle correction. Here, in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting a removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, cancer, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, etc. come under the umbrella of lifestyle diseases. 90% of the medication and 90% of the surgeries are for lifestyle disease. This means that 90% of the medicines and 90% of the surgeries can be avoided. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medications, no surgery that created the disease. This is why once medication is started, very often both the disease and medicines will keep on adding more numbers along with the unwanted side effects. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I'm Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed Diploma and MD in Obstetrics and Gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine and surgery, joined government service, later resigned from government service and in 1997 started practicing as consultant at Life Care Center, Pevara, Kochi, focusing on lifestyle modulation with clinical support for lifestyle diseases, minimizing the need for medication and surgery. Another important thing every patient should understand is a patient's role in drug pollution. Major part of the medications we take are excreted in urine, sweat, and stool. It will reach the groundwater, rivers, drinking water, plants, animals, and food products. That means the medication we take is becoming a threat not only to us, humans, but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle disease, and come out of medications to protect our children, grandchildren, and the coming generations from the ill effect of toxic pharmaceutical pollution. We should come out of the dependence on medication. Current norm of chronic patients on lifelong medication has to change. Spreading awareness on reversing lifestyle diseases and minimizing medication is the need of the hour. Therefore, remember to share this to your relatives, friends, and colleagues who are on chronic medication or planning for lifestyle disease surgery. Thank you.